Hello, my name is Aaron Munns. I'm the Veterans Director at the Mesothelioma Center at asbestos.com, and today we're going to be talking about asbestos-related disability claims and benefits available from the Veterans Administration and some civilian benefits that may be available for veterans diagnosed with certain asbestos-related cancers. Asbestos.com is a free help center, and we are dedicated to serving veterans affected by asbestos diseases and collaborating with veteran service officers to assist veterans in their community. The Mesothelioma Center at asbestos.com has been helping veterans for 19 years with dedicated free assistance for veterans and veteran service officers. I, as the Veterans Director, have been here since 2015, and Danielle DiPietro, who started our program for Veterans Outreach, has been with the team since 2012. We are both VA accredited claims agents and provide free information and assistance for veterans and veteran service officers. Since 2017, we've assisted over 5,000 veterans who have been affected by asbestos exposure during their service. We also help over 50% of all mesothelioma cancer patients in the U.S. connect with us for help and information. Since 2018, I have personally conducted over 60 training classes for veteran service officers and trained over 4,000 veteran service officers in 26 states. We also have YouTube asbestos videos for veteran service officers and veterans, and we help veterans connect with doctors, VA benefits, and legal compensation if they're eligible. Today we're going to be talking about understanding VA claims evidence development for veteran disability compensation. Asbestos is a naturally occurring mineral that is mined from the ground. It is used in a powder form. It's added to hundreds of different materials that were used by the U.S. military, including construction material, insulation, pipe lagging, brake pads and clutch faces, flex gaskets and pump packing, engine heat wraps, adhesives, fireproofing, fire-resistant personal protective equipment, and even used in Navy non-skid paint to make the paint more durable and resistant to heat and fire. It typically takes 20 to 70 years after you're exposed to asbestos before you have any symptoms. As a result, most of the veterans who we are working with today were exposed to asbestos in the 1960s through the 1990s. Very few of them were diagnosed with an asbestos-related illness while they were on active duty. That's one of the reasons why asbestos-related claims are so challenging with the VA, because you have to establish your diagnosis and have your doctor connect it to exposure to asbestos, but then you also have to prove how, when, and where you were exposed to asbestos, typically decades prior to when you're actually diagnosed with an illness or a disease. In the next few slides, we're going to look at some pictures of common uses of asbestos. The first and most common exposure to asbestos was aboard Navy ships. All of the steam pipes, hot water pipes, electrical conduits were all insulated using asbestos insulation or pipe lagging. Here you see in the galley on the USS North Carolina, and one of the pipes lagged with asbestos. Some electrical conduit and the boiler room or the engine room covered in asbestos materials. Asbestos rope and flex gaskets were all made of asbestos. It was also used on all wheeled vehicles and tracked vehicles for brake pads, brake rotors, and clutch faces, used across all branches of service from the 1940s through the early 1980s. It was used in personal protective equipment and firefighting gear, as well as heat-resistant gloves and mittens that were used by machine gunners, artillerymen, armored crewmen. It was also used on all rotary wing and fixed wing aircraft before the early 1980s. So if you've had exposure to asbestos, you need to understand the conditions that the VA recognizes may be caused by exposure to that asbestos. The current conditions that the VA recognizes are interstitial pulmonary fibrosis or asbestosis. So that's when you inhale asbestos into your lungs. The little fibers, when they're airborne, when they're disturbed because of friction, breaking apart, demolition, or battle damage, or just due to old age or repairs, those fibers enter your lungs and they're like little fish hooks. And when they embed into your lung tissue, your body's natural reaction is to form harder tissue around each one of those fibers to insulate them or isolate them. Kind of like if you get a splinter in your finger and don't take it out, you get that harder skin around the embedded splinter. Same thing can happen in all different parts of your body. You can also swallow the fibers and they get into your digestive and urinary tract. The most common disease is scar tissue in the lower lobes of your lungs. When you have scar tissue in the air sacs at the end of your lungs, over time, that scar tissue can cause fibrosis. Interstitial pulmonary fibrosis is scarring in the spaces in between the air sacs in your lungs. And this can reduce your overall lung function and can cause shortness of breath, cough, chest pain, tightness in your chest, and fluid to build up in the pleural space in between your lungs and your rib cage. When that fluid builds up, that's called pleural effusion, or fibrosis in the pleural lining, scarring in the lining between your lungs and your rib cage. It can also cause pleural plaque, which is patches of calcified, harder tissue on that pleural lining. It can also cause mesothelioma cancer of the pleural lining and the peritoneal lining, which is the lining around the abdominal organs. The VA also recognizes that asbestos exposure can cause cancer of the lung, bronchus, gastrointestinal tract, larynx, pharynx, and urogenital system, except the prostate. The latest update of the M21-1, the VA's rating manual, where they discuss asbestos exposure and asbestos-related claims, does not include prostate cancer. However, there is new medical evidence published in the last few years that shows an increased risk of developing prostate cancer if you've had exposure to asbestos. Another thing to note is that if you have a lung disease, which reduces your overall lung capacity, it puts added stress on your heart. And when someone has asbestosis or interstitial pulmonary fibrosis, they can develop a heart condition called cor pulmonale, or heart disease, which is secondary to a disease of the lung. And you can get service connected for that heart disease if you talk to your cardiologist and your pulmonologist, your lung doctor, to connect the two conditions. Another thing to note is that asbestos exposure, there is significant medical research that shows that it is an established cause of ovarian cancer. The VA, it's not on the VA's asbestos conditions list, but there is significant medical evidence that shows a direct connection. So you can also get approved for that. So if you're a veteran or a veteran service officer and you know that you've been exposed to asbestos, what should you do? You should be aware of the symptoms of asbestos lung disease. Now, these symptoms are very similar to more common lung diseases such as COPD, chronic bronchitis, or emphysema. And often a veteran will be diagnosed with COPD after describing their symptoms, and if the doctor discusses their smoking history, they may diagnose COPD. They may do a chest x-ray, they may not. They'll likely prescribe some inhalers to help open up the bronchial tubes to increase the amount of air that can be expelled from the lungs. And they might schedule a follow-up appointment in a year depending on the symptoms, if there's any change. But in order to diagnose an asbestos lung disease, you have to dig a little bit deeper. So if you're having chest pain or tightness, shortness of breath, fatigue, a persistent dry cough, so you're not coughing up any phlegm and it's not tied to the seasons or other allergies, clubbing of the fingers or toes, crackling sound when you're breathing, or a loss of weight or appetite, that could be a sign that there is something more than COPD, or an asbestos lung disease that's present, potentially an asbestos-related cancer. And it's worth discussing with your doctor, explaining how and when you were exposed to asbestos so they can do some additional tests to see if there's something that is a root cause of this. This is especially important if you have any history of smoking and the doctors aren't thinking that there's something else that may be present that's contributing to your symptoms. So every veteran who's had exposure to asbestos has likely been through the VAs. If they're enrolled in the VA healthcare system, they've gone through a terror screening, which can result in with several different tests and referrals to specialists, or it can end with just, okay, we understand what you've been exposed to without any follow-up. It's up to the veteran to really advocate for their own health and ask for the appropriate tests. So if you've already had that terror screening, we recommend connecting with your primary care doctor, either through the VA Healthcare Administration or through your private provider, and ask for a CT scan of your lungs, a CAT scan of your lungs. The CT scan can show the early stages of asbestos lung diseases, pleural plaques, the beginnings of interstitial pulmonary fibrosis or asbestosis. It's also what is used to screen for lung cancer and mesothelioma cancer. So if you haven't had one done and you served any time between the 1940s or overseas as part of the global war on terror in Iraq or Afghanistan or Southwest Asia, we recommend having a CT scan done, even if you don't have any symptoms at this time. It can be a useful tool if in the future, 5, 10, 20 years from now, you do have symptoms and you have another scan, they can use it and compare it to the previous scan, and that can also make it easier for the doctor to identify any changes between the two. In addition to a CT scan, we recommend having a pulmonary function test with spirometry performed. This will measure your overall lung capacity, and it is what the VA uses to assign a disability rating if you are granted a service-connected lung condition. If there's any type of cancer suspected, a PET scan and a surgical biopsy to determine the type of cancer will also be recommended. We have a medical questions checklist that's available if you email me at aaron@asbestos.com, and I'll post my contact information on the last slide. But it's designed to help a veteran guide the conversation with your doctor so that you can get the correct diagnosis and an accurate diagnosis. We'll talk briefly about mesothelioma cancer, which is a very rare diagnosis. There's only about 2,500 cases diagnosed in the United States each year. But out of those 2,500, veterans make up about 30% of the diagnoses. So about 800 or so of these very rare and aggressive cancers are military veterans. If a veteran is diagnosed with a mesothelioma cancer of the pleura, the peritoneum, the lining around the abdominal organs, or the pericardium, which is the lining around the lungs, which is extremely rare, you are eligible for civilian compensation in addition to VA disability compensation. And if you contact asbestos.com, we can help connect you with additional legal compensation if you haven't already found someone. I've been doing this for 10 years, and we know what firms have the best relationships and the most experience for particular types of exposure in different branches, different locations, and different products, as well as civilian exposure. So we can help make a recommendation for you. All asbestos-related claims have the same requirements. There must be a valid diagnosis with a medical nexus statement. And if you're unfamiliar with a nexus statement, it is a letter from your doctor where they connect your current diagnosis to what may have caused it. Nexus means link. So in the letter, they state what you've been diagnosed with and how that may have been caused by, in this case, asbestos exposure. You also must be able to prove your exposure to asbestos during your military service. including a majority of your lifetime exposure. We often get a lot of questions about the PACT Act that was passed in 2022. The PACT Act, which it expands presumptive conditions for burn pit exposure from the first Gulf War through the current war on terror, Agent Orange exposure, some radiation testing, and contaminated water. It does not mention the word asbestos a single time. So many veterans have some confusion about the presumptive conditions because there is overlap between some of the conditions caused by those other toxic exposures and the conditions that are caused by asbestos. But there is nothing presumptive for non-PACT Act asbestos claims. You have to prove the medical connection and the majority of military exposure. If you're a veteran who qualifies for benefits under a PACT Act exposure because you've served in Iraq or Afghanistan or Southwest Asia, and you're diagnosed with, let's say, lung cancer, it is my recommendation to file that claim under the PACT Act because it's a presumptive and it's easier to get approved. There's less burden on the medical side to prove what the cause may have been. However, if you do not qualify under the burn pit exposure, you served in the 70s or the 80s, you're not a wartime veteran, and you were exposed to asbestos, these are the steps to help get that type of claim approved. You have to have that nexus statement. It must include the connection between your current diagnosis and asbestos exposure. For cancers in other parts of the body other than the lung, this typically requires a diagnosis of an asbestos lung disease. So if you've been diagnosed with kidney cancer or colon cancer, but they have not done a scan of your chest where asbestos symptoms usually begin, we recommend to get a chest CT scan if you haven't had one done in the past year. The nexus statement from your doctor, from a specialist, it can't be from your primary care doctor. It needs to be from your pulmonologist, your oncologist, your cardiologist, your specialist who's treating that specific body part, has to refer to the scans, the CT scans, and what they see on those, a pathology report if a cancer has been detected with the cell type and what are the probable causes of that type of cancer, or other existing asbestos-related illnesses. So if you have bladder cancer and you think that it may have been caused by asbestos and you're talking to your doctor and they do a CT scan of your chest that shows that you have some calcified pleural plaques, which may not be causing any symptoms but are evidence of previous significant asbestos exposure, the doctor can say that your bladder cancer is more likely than not due to exposure to asbestos because of the evidence of asbestos-related calcified pleural plaques on the CT scan. We'd also recommend having your doctor write that your current diagnosis is consistent with the latency period of your exposure to asbestos during your service. Right at the beginning of this, we talked about 20 to 70 years from when you were exposed to when symptoms are presented, when you're diagnosed. So if you are diagnosed with that bladder cancer, you have the calcified pleural plaques, and you served in the Navy in the late 1970s, your doctor could say that this diagnosis is consistent with the latency period of asbestos-related blood or bladder cancer, which typically ranges from 25 to 55 years, consistent with the veterans or the patient's exposure to asbestos during their service in the Navy from 1976 to 1980. That's the type of wording that has been effective to help get claims approved. Now, I have examples of nexus letters in medical studies that support a nexus for all of the conditions that the VA recognizes, as well as the medical evidence that you can share with your doctor if they're not sure what the connection may be. Email me and I can provide that to you. So once you have the correct diagnosis, you've got that nexus statement, the next piece is providing information about how and when you were exposed to asbestos during your service. We accomplish this by writing a statement in support of claim. We call them asbestos exposure summaries, but they're a personal statement about how, when, and where you were exposed to asbestos during your service. The most common reason that we see asbestos claims are denied, assuming that there is a valid diagnosis, is that not enough information about military exposure was provided in the initial claim. The VA is getting better at conceding exposure to a toxin, including asbestos, but the veteran still needs to prove that a majority of their lifetime exposure occurred on active duty. This is how the statement in support of claim is how we prove that exposure. And we want to detail duty location, ships that you served on, specific equipment that you did, and how, when, and where you were exposed to asbestos. And again, I have a lot of examples of these exposure summaries that you can use as a template to put your own experience into the format that the VA is looking for. The War-Related Illness and Injury Study Center put out a updated asbestos exposure pamphlet in May of 2024. And on this, they highlighted that Navy veterans who served on ships whose keels were laid before 1983 are at risk for asbestos exposure. So different than the Agent Orange ship list for exposure to asbestos on Navy ships during Vietnam, there is no asbestos ship list. What there is information here about basically if your keel of your ship was laid before 1983, it's assumed by the VA that there was exposure. Now, just having exposure isn't enough to qualify for benefits. You still need the valid diagnosis, and you need to prove how, when, and where you were exposed to that asbestos. So every veteran that I assist, and as I mentioned, it's been thousands over the last 10 years, the first question I ask them is, do you think you had more exposure during your service? If the answer is yes, or I'm not sure, we start digging into how and when they were exposed. There are some veterans who clearly had more exposure to asbestos as a civilian, either before or after their service. Right? They were an 11 Bravo in infantry, light infantry in the Army. They only served for a few years. They spent most of their time in the woods with a heavy rucksack on their back and a rifle. They didn't spend a lot of time connected with asbestos. Then after service, they went and worked in construction for 30 years. They know exactly how they were exposed during their civilian career. If that's the case, the VA is not going to take responsibility for your asbestos-related disease. We can see if there's any civilian resources that you may be eligible for, but the VA, you won't meet the qualifications or the requirements for a service-connected disability for asbestos. And we recommend connecting with your veteran service officer to see if there's any other benefits that you may qualify under the VA. For all those other veterans, we want to know where, when, and how you were exposed, right? I've said that several times at this point, but by detailing it is the way that you get the VA rating officer, who may not be a veteran themselves, may not have served in your branch of service or with the equipment you worked with or on a Navy ship. It's how you teach them how you were exposed so that they can connect the dots and approve that the majority of your exposure was in the military. So if you served in the Navy or the Coast Guard, there is a list of all the job ratings in the M21-1, and they categorize each job rating as highly probable exposure, or minimal exposure to asbestos. Now that's just a starting point. It's not just because you are a hull technician and your rating is highly probable. That's just a starting point where you then describe all the exposure you had. If you were a yeoman and it says that you were minimal exposure, that doesn't mean that you can't get approved. It just means that you're really going to have to describe how you were exposed to asbestos. If you served on a ship whose keel was laid before 1983, we'll mention that. You can also include that the Risk C exposure to asbestos info sheet and include that as part of your claim. If you spend time in a shipyard or in a dry dock maintenance period, describe that. Did you live on the ship during that maintenance period? What did you do that was different from your job rating? If you were a yeoman but you stood fire watch in the boiler room while yard workers were re-bricking the boiler and ripping asbestos out, and you were spent 4-hour shifts on fire watch while asbestos dust filled the boiler room and made it look like it was snowing. Describe that. If you served on any other branch of service, we want to know what type of equipment you worked with. Did you work on a vehicle? Did you spend time in the motor pool? Did you do maintenance, PMCS, or other services? Did you work with mechanics who had higher exposure to asbestos? Did you work on brakes or insulation? Did you do any construction or building demolition? If you served in a combat zone, were you exposed to battle damage in a combat zone? If you did, the older buildings likely had asbestos as part of their construction material, and if you punch a hole with a main gun round from a tank and then go into the building afterwards, it's filled with dust, and you breathed in all of that dust and may have had exposure that way. Did you work outside of your MOS or on work details or did maintenance? Were you on the Sergeant Major's detail where you demolished the old post church and tore it down for 3 weeks while you were on a work detail and had exposure to that demolition? We also need to know what type of work you did before or after your military service. This is essential to prove, again, convince the VA that you had more exposure in the military. We also want to know if you received any training or personal protective equipment for handling asbestos, either in the service or during your civilian career. I've spoken to a lot of veterans who were exposed in service, weren't given any PPE, continued in a job where there was exposure as a civilian, but after 1983 or so, when OSHA passed new asbestos regulations for safe handling of asbestos in the civilian sector, they were given training and personal protective equipment that limited their exposure after 1983. So calculating the amount of asbestos exposure, if there is civilian exposure, is essential. The VA primarily looks at the number of years of possible asbestos-exposed work, and they will assume that a year as a civilian is equal to a year in the military, but it's not. For example, if you served a year on a Navy ship, you were exposed every minute that you were on board the ship. In a year, you had over 8,000 hours of exposure to asbestos. If you worked in a factory or in construction and you worked 50 weeks a year, 40 hours a week, you had about 2,000 hours of exposure. And that's assuming that you were working with asbestos fibers every minute of your on the job, which likely is not the case in most civilian work environments. But you can show that a year on a Navy ship is equivalent to at least 4, if not many more years of working in a civilian sector. You can also say that you received training after 1983. If you worked at Ford or GM or Chevy, they stopped using asbestos brake pads in and around the early 1980s because they were then going to be held liable for exposing their workers to asbestos. Rather than being held liable and being open themselves up to future litigation and workers' compensation, they replaced their products, their brake pads and clutch faces, with safer or different materials. So all of that can be used to show that you had more exposure in the military. For every exposure summary, we add a couple of key phrases. First, we say that your military records in your service are not going to show any asbestos-related diseases due to the long latency period. This is consistent with the M21-1, the VA rating manual that I referenced. And the quote from that M21 says, "Many people with asbestos-related diseases have only recently come to medical attention because the latent period for development of disease due to exposure to asbestos ranges up to 45 or more years between first exposure and development of disease." When I first started doing this 10 years ago, we saw several claims get kicked back or denied by the VA because there was nothing in the active duty medical records diagnosing or complaining about asbestos-related symptoms. But that's not how asbestos affects the body. Again, it takes 20 to 70 years after exposure before there are any symptoms. So we started adding this phrase to each one of those personal statements that gets submitted with the disability claim, and we've only seen one get kicked back. We acknowledge, we believe that the VA made an error, submitted a higher level review, and that was approved by the higher level review. They corrected their error. I have exposure summary examples for currently, as of this recording, 76 different job specialties across all branches of service. Haven't affected or haven't helped anybody who's a Space Force veteran yet, but all the other branches that used asbestos in the 60s, 70s, and 80s, we have a long list. So if you're a veteran service officer or a veteran who's looking for some information about how to get the claim started, send me an email and I can provide you with an example. To contact our team, email me at aaron@asbestos.com. You can also go to my YouTube channel at Asbestos Veterans Assistance. All of the references that I discussed are on these hyperlinks. Please let me know if I can help. We are here to make sure that veteran service officers have all the information to assist the veterans in your community. And for veterans looking for assistance, you can contact your veteran service officer or contact me directly, and we'll try to help in any way that we can. Thank you.